This is Dr. Jacob Egbert with Primal Mountain Medical, TRT, and Men's Health Clinic. Now, I'm going to go over the top 10 frequently asked questions. Anytime somebody is coming to me and asking about testosterone replacement therapy, they have a whole list of questions. Now, these questions are very appropriate, and I think doing your due diligence to investigate something that is essentially a lifelong commitment and quite considerably a life-changing commitment, you got to know all the details. And I think these questions are very relevant and should be asked by everyone considering testosterone replacement therapy. Now, these are the top 10. There are, of course, going to be more questions and more questions specific to your particular needs. So I invite you to schedule an online consultation and we can go over all of your particular questions, as well as we can review these top 10 questions as well. So let's get into it. So the number one top frequently asked question that I get regarding testosterone replacement therapy is, my numbers are normal or within the normal range. Is TRT still an option? Now, this is where a lot of physicians will part ways. There are those that are more traditionally trained that aren't familiar with testosterone replacement therapy as an optimization technique. Now, ranges on lab values in testosterone in particular, we look at total. Total testosterone can be from 280 to 900 and considered normal. Now, when we get into normal values as medical providers, typically what that means is absence of disease. So the healthcare industry is largely set up to prevent death and pop people out of illness or disease. Beyond that, it's not the responsibility of physicians typically to interact with patients. We're not here to make you healthy. We're here to make sure you're not sick or don't die. So in the range between 280 and 900, that's essentially saying you don't have disease. Below 280, you may have something majorly wrong with you. And if your testosterone levels are above 900 without exogenous testosterone just naturally, there may be some hyperactivity potentially and needs to be worked up. And therefore, anything between those two values is considered normal. Now, fortunately, the medical industry does recognize symptoms associated with low T. And I've done an entire video on this, and you can reference that in the library. So low T symptoms can appear anywhere within that range because of a number of other factors, which we get into in our consultation process. So absolutely, if you have normal numbers, you may qualify for testosterone replacement therapy based on your individual circumstances and symptoms. So reach out for consultation if you want to review your own particular numbers and symptoms. All right, number two, most frequently asked question. I hear a lot about boosters, HCG, Clomid, and herbal supplements that can raise natural production of testosterone. Is this just as good as taking testosterone? And do I need to take these while on testosterone replacement therapy? So short answer is nothing is going to be as good or effective as testosterone. Testosterone by itself is the most powerful substance or hormone that you can take to make the difference you're looking for with low T symptoms in the pursuit of optimization. Now, some of these other medications can naturally boost your own production of testosterone, and you may consider that as an alternative. Now, in my experience and my observation and study, those aren't going to be as effective, and especially not long term, and many of these medications come with their own slew of side effects. So the cost-benefit ratio doesn't seem to be in the favor of the individual taking them, unfortunately, and therefore I would say not as good and not necessary if on testosterone replacement therapy. And we can go into the particular details of this in our consultation, but essentially I say no, not necessary. And if you're on testosterone replacement therapy, absolutely not necessary. All right, number three, will I have to use needles and inject myself with testosterone? Short answer is yes, and there is an alternative. You can do a topical. Now, the topical cream is a little more expensive and requires twice a day dosing. So every morning, every evening, you're rubbing the cream on. So that's 14 times per week that you are thinking about and participating in your testosterone replacement. Now, for some people, they love that, and that is the path that they follow. Others elect to go with the injection. Now, my recommendation is a more frequent injection process. So I start people out on 3 times per week. And if that's prohibitive for them and they're reticent to do the 3 times, I think 2 can be okay. Ideally 3 or more. If you can divide your dose into more frequent injections, you'll get the best outcome. Now, historically, people would prescribe testosterone injections once per week or once every 2 weeks. I've heard of even once every couple of months, an extremely high dose. And some people will inject pellets into you that dissolve over time. And I would say that these archaic methods will leave you wanting significantly if you follow that path. So, are needles necessary? No, they're not necessary. There is a topical option, but most people elect to go with the needles because actually it is quite easy. And with the size of needles we use, it's almost pain-free and really not a big deal. All right. Question number 4. Is this something that I have to do forever? Now, of course, you don't have to do anything. This is a choice to be made and to really consider getting on testosterone replacement therapy. Because essentially what you're doing is you're replacing your own production. And why do we do this? Well, you came to the clinic or you came to this situation with lower testosterone than is optimal for your needs. You have the symptoms, you have the problem, and you're looking for a solution. So you get on a replacement, and therefore we suppress your natural production and completely replace it with exogenous testosterone to a level that is optimal for you. So essentially you take complete control of how much testosterone your body receives. If you are in the 300 or 400 range and you might boost it up to 500 and then it drops back down to 250 and then it's up to 500 again and then 300 and you're really trying to get that higher and higher, it doesn't stay where you get it. You always have to do the things to reach it up to that point, and there will be fluctuations, which if you have the low T symptoms will return, maybe go away temporarily and return again. When you get on exogenous testosterone, you fill it up and you maintain that for as long as you're on it. Now, some people may say, well, I might try it for a while and then I may decide to get off. If you get off, you drop completely down until your body rebounds to its normal levels. And normal levels are those fluctuative levels that left you with low T symptoms. So most people, once they get on the testosterone and they get dialed in, they get that optimal level and they're feeling amazing. The thought is, I don't ever want to go back. And whatever I have to do to maintain this is worth it. So likely, here, short answer is yes, it's forever. And you'll get to the point where you're very happy to do so, because the thought of going back to where you were before is worth the investment. So, number 5, most common question, are there side effects? Now, this is an interesting question because in reality, testosterone is a part of you. You produce it naturally, and what we're doing with testosterone replacement therapy is essentially just taking you to an optimized level of a normal hormone in your body. Now, I can give you some fun analogies like, well, if your arm got cut off and we replaced it, now you have a new arm that's working just like the one before. Is there a side effect to having an arm when previously you didn't have an arm? No, that's assuming that you were replacing it with a normal arm. So that's a silly analogy, but essentially what we're doing is we're just putting back something that should be there in the first place. You operate normally with testosterone and optimally with your optimal level of testosterone. So there shouldn't be any side effects, quite honestly. If we get you to the optimal level, it should be a normal, optimized scenario for your hormonal profile. Now, where people do get side effects is when they fluctuate, when they're going up and down. So if you're taking testosterone in high doses and then waiting in a week or 2 weeks to get another high dose, or waiting another 2 weeks and get another high dose, or you've got a pellet injected where you get this high dose and it dissolves at a unequal rate and you're getting these weird fluctuations, you likely will get side effects. Now, acne, gynecomastia, mood swings, there's so many side effects that come with those fluctuations. Where those are reduced, if not almost eliminated, is when you have even levels. And that's where our frequent dosing comes in and dialing in to the right level for you that is optimal for your physiology. So, next question, number 6. You do cash pay. Why don't you take insurance? Well, there are many reasons for that. Administratively, in order to operate at the level that we do, we don't have time to deal with insurance companies. That is an archaic method that the standard medical system can deal with. I'm not going to do it. If you want to go through insurance, you're going to have to go to a provider that takes insurance, and likely they're not doing what we're doing. So that's one reason. Another reason is this: insurance companies won't typically approve testosterone replacement therapy if your numbers are within the normal range, because they have algorithms and they're trying to withhold care as much as possible in order to optimize their returns. So it's a game and there's a fight, and it's an unfortunate balance for the providers and your insurance company for you to try to get what you want. So we don't deal with that. We take cash. That allows us the freedom to optimize you and give you what you need all the time. So, short answer, I'm not going to do it. Number 7, can I just buy it from a friend? I hear he's got a source online. He can get testosterone. Go for it. Not really. I can't advocate for that. And I have clients that have previously done that, and then they got prescription level testosterone and they can notice a difference. It's a clean product. It's been regulated. It's been cleanly prepared. Whereas the stuff you buy online or from your friend, you have no idea where it's coming from. You have no idea how it was made, and you have no idea what's in it. So I highly recommend that you not take testosterone through underground means. Public service announcement, just don't do it. So it's a gamble. I don't think it's worth it. In addition to that, you don't have somebody overseeing the process that's educated in hormone balances, and therefore you're not going to get the lab work. You're not going to get the opinion of an expert. So number 8. Number 8, most frequently asked question: what's the process? So I've done my best to streamline it here at Primal Mountain Medical. I do online consultation. We do a Zoom call, essentially. We go over your symptoms. We go over your medical history. We go over your lifestyle factors. And then we get lab work. And then I review that lab work with you. We talk about your options. And then we come up with a plan. I submit an order to the pharmacy, and then they mail it to you. Once you get your product, then you have instructions on how to apply this. And then we have conversation. If ever you need it, you reach out, I answer questions, and we get you dialed in. Within 8 weeks, we repeat labs to see how that initial dose reacted in your own body and what your numbers are on 2 months of replacement therapy. At that point, we'll reassess your dose and see if we need to go up, go down, stay the same in order to get you dialed into that optimal level on 2 fronts. 1, symptoms. I want you feeling amazing. And number 2, I want to see those numbers as a guide. Now, I do calculations from the total testosterone. I use albumin, sex hormone binding globulin. I'm looking for your free testosterone. And that's really the number that we're looking for, because the free testosterone is what's available to be used. And therefore, you may have high levels of total testosterone, but low levels of free testosterone. So the object is to get that high. And there are techniques with administration that can lower sex hormone binding globulin and get you dialed into where you get that optimal level, both laboratory-wise and experientially. So, number 9, most frequently asked questions: when will I notice a difference? Now, I went over this in one of my previous videos, the top 10 myths, and I'm going to say it again. It's a slower process than you might think. It's not instant. It's not immediate. It's not like a caffeine or some other drug that you take and within minutes you notice the effect. Testosterone takes time. Now, typically, in order to get dialed in, once you start testosterone replacement therapy, it can take you 6 months to get all of your symptoms resolved. You may get your numbers up to the ideal level and you may start feeling really good within those first 2 months. But really, the next 4 months after that is where a lot of those symptoms start to resolve, because your body, it's not a computer. You don't push a button and it's immediately running a new program. It takes time to adapt to the hormone at its optimal level. Now, in addition to starting testosterone replacement therapy and getting your optimal numbers, the added benefit of increased drive and motivation, you typically, if you're doing what you need to do, will be going to the gym and eating better, and you just have more zest for your body, doing well and taking care of yourself. So a lot of those symptoms resolve over time because you are more active, you are more focused on your health. So I'd say about 6 months in, you should have near resolution of those low T symptoms. Now, along the way, we can add other medications if needed for erectile dysfunction or other things that come up. You want to try some peptides. We can help you with optimization in other areas. All right, number 10. How can I make the most of TRT? Now, similar to the last question, number 9, there are things that you can do to enhance the experience of testosterone and the effect. So testosterone, of course, as we talk about in other videos, such as the top 10 benefits, one of the main benefits is muscle mass growth. You go to the gym consistently while optimized on testosterone, you will gain muscle. You'll gain muscle size, muscle strength, muscle endurance, and overall your body will start to change, which leads to lean body mass. So what can you expect and how can you make the most of it? Well, you can expect to lose body fat. You can expect to gain muscle mass. You can expect to gain strength. You can expect to gain assertiveness and confidence and decisiveness. All of these things that just put you into that hyper efficient and very masculine driven approach to life. Essentially, you become the man that you know yourself to be. So how do you do that? Well, follow the feelings of drive, follow the recommendations for lifting weights, going to the gym and really getting after it. We do have some protocols within Primal Mountain Medical that are pretty basic. Now, those are just free for you as subscribers, and we do have the option of adding more training and more personalized developmental transformational programs. So there are a lot of ways to optimize it, and we will provide those for you. So these are the top 10 frequently asked questions when starting or considering testosterone replacement therapy. Now, I invite you to reach out, get a free consultation with me, and we will discuss all of these and more, anything that's more personal to you, and see how we can get you optimized.